Well, this morning, doctors across the U.S. are trying to figure out what's causing an alarming spike in colon cancer cases in young people. The American Cancer Society estimating around 153,000 people will be diagnosed this year. Nearly 20,000 patients will be under the age of 50. And those numbers have doctors predicting a 124% spike in colon cancer cases in patients 20 to 49 by the end of the decade. We'd like to welcome colon and rectal surgery specialist and University of Wisconsin School of Medicine and Public Health professor, Dr. Dana Hayden. Dr. Hayden, great to have you. As you know,
good morning.
Good morning. Well, colon cancer is expected to become the leading cause of cancer-related deaths in young people in around 7 years. That's alarming. So what is behind this rise?
So we're not really sure, and researchers are trying to figure this out. We do assume that some of it does have to do with environmental factors like diet, decreased exercise, and poor lifestyle choices like increased smoking or drinking. But there's definitely some other factors like that could be related to genetics, that could be related to tumor biology. So we are trying to work very quickly to figure this out.
So CDC guidelines say most people should begin regular colon cancer screenings when they're around 45. But do those guidelines, would you say, need updating with this new evidence?
So that actually was a recent change due to the spike that happened that was seen a couple years ago in some of our trends. So the age was moved down to 45 not too long ago, less than 2 years ago. But what remains really important is paying attention to any symptoms that young people may be having and bringing it to their primary carers or to their parents' attention, and shouldn't be overlooked just because the patient may not be 45 years old. So there could in the future be further decrease in that age for screening. But that is why we have to remain very vigilant to pay attention to symptoms that young people have before that age.
So do you mind outlining some of those symptoms, and are there things people can do to prevent their risk of colon cancer?
Sure. So the most common symptoms are either blood in the stools or rectal bleeding, changes in bowel habits like new diarrhea or new constipation, sometimes abdominal pain or the urgency to have a bowel movement. What's good is that those symptoms are very nonspecific and likely related to other problems, like maybe just hemorrhoids or other types of non-cancer causing problems, right? So, but you also have to be aware that they could be related to cancer, and it should trigger someone to mention it, bring it up, and start asking to get a colonoscopy.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.